Good morning, everybody. I am Dr. Rajita Esther. I'm going to speak about the uses and techniques of local anesthetics. Okay, there are different types of the local anesthetics. I actually in the previous video, which if you can go through it, I've already discussed the basics of the local anesthetics, local anesthesias, and what are the advantages of local anesthesia or differences between the general anesthesia and the local anesthesia, the definitions, all those things. And in this session I am going to discuss about the different techniques or different procedures of the local anesthesias and their uses. Let's come to that. First one is the surface anesthesia. Surface anesthesia means keeping that particular local anesthesia or local anesthetics over the surface or locally here you can go through when we are seeing the endoscopy, we are applying that it's not over the skin. Actually we are applying that particular local anesthesia to the tube so that the reflexes can be prevented when we are inserting the tube into the nose or into the throat or into the through the anus or into the rectus. In all these things it is decreasing the reflexes, and also the pain sensation also can be decreased. And for the different, when it comes to the tonometry, we are applying over the conjunctiva surface. So surface anesthesia comes as a uh, topical and also the local. So, what are the advantages of this that particular uses of the surface anesthesia? In the eye, as we discussed, tonometry to check for the intraocular pressure, and the cataract surgeries, and also other ocular surgeries, and drops for the nostril and ear drops for the painful lesions and the polyps. Mouth and the throat, in the mouth and the throat we can use for the stomatitis, sore throat, and also painful ulcer. And when it comes to the pharynx, larynx, trachea, and the bronchus, we are using for the tonsillectomy, endotracheal intubation, endoscopies, and in esophagus and the stomach for the gastritis, esophagitis, heartburns. Over the abraded skins, ulcers, burning, itching, and dermatosis, intact skin for insertion of the cannulation, IV cannulation, or any skin surgeries, and urethra dilatation and catheterization, and the anal canal we are doing for the painful, and for the anal canal for the painful piles and surgeries and the fissures and the proctoscope. This is about the what is surface anesthesia and what are the uses of the surface anesthesia. Next, come to the different injectable. Among the injectables, there are many types of. We are using injections to do the local anesthesia. The initial part is the infiltration anesthesia, field block, and the nerve block. Here look at the local anesthesia by through the infiltration. You can notice the what are the differences. Here the infiltration anesthesia we are having uh, only part will be subcutaneous only, but here the nerve is mainly that particular part, whatever the small sensor nerves are there, they are blocked by the diffusion of the anesthesia. When it comes to the field block, that particular sensory nerves whatever are there at that fields are blocking. Okay, here when it comes to this particular nerve block, what we are doing, we are blocking the nerve. Okay, so I will discuss detailedly. Infiltration anesthesia, infiltration under the skin in the area of operation. so that sensory nerve endings are blocked. So, we can use the lidocaine and the bupivacaine. The uses mainly by using this particular infiltration anesthesia are mainly incisions, excisions, hydrocele and heniorrhaphy. So, to do the surgeries like hydrocele and heniorrhaphy, we can use the infiltration anesthesia. Conduction block. Conduction blocks again divided into two types. One is the field block, another one is the nerve block. In the field block, the injection of the local anesthesia is given subcutaneously here also, that all the nerves coming to the particular field are blocked. For this, using this particular field block, we are using so many surgeries like heniorrhaphy. Here also we can use the heniorrhaphy by the field block, and also the appendicectomy, dental procedures, scalp stitching, operations on the forearms and the legs, operations in the legs also we can use by using uh, using the field block. Let's come to the nerve block. In the nerve block, it is produced by the injecting the local anesthesia around the appropriate nerve trunks or the plexus. The area of resulting anesthesia at this is larger when it compared to the amount of the drug we are used. Or muscle supplied by the injected nerves plexus are also paralyzed. So the latency of this nerve block is depends on the area to be covered by the diffusion. For example, when it comes to the brachial plex block for the intercostal nerves, it takes only 3 minutes. When it comes to the intercostal nerves, we are taking the 3 minutes. When it comes to the brachial plexus to block, we are taking 15 minutes. So, for the plexus block, we are using the flooding technique to be used the larger volumes. For that, we need a larger volume. So, now block lasts longer than the field block or infiltration anesthesia. It takes a longer time to be lost. Frequently performing the nerve blocks are mainly in the lingual, intercostal, ulnar, sciatica, femoral, brachial, trigeminal, and phrenic, etc. Phrenic nerves. So, by blocking those nerves, what are the procedure we can use is tooth extractions, operations in the trigeminals, facial nerves, or on the eyes, on the limbs, abdominal wall, fracture settings, trauma to ribs, and the neuralgias, persistent hiccups. By blocking the phrenic nerve, we can reduce the persistent hiccup, and blocking the trigeminal nerve basing on that particular neuralgia. That's those kinds of an example we can use. The primary purpose of the nerve block is anesthesia to abolish the pain and other sensations. Here there is accompanying of the motor paralysis also, that is also advantageous by causing the muscle relaxation. The disadvantages is after using this particular nerve block, there may be some of the breathing difficulties, ability to walk after operation, and patient labor produces the postural hypotension. Those are the disadvantages of using this. So here we are clearly can see differences between the three kinds of the injection. See, infiltration anesthesia also we are giving the subcutaneously, field block also we are doing the, nerve block also we are doing that. But here infiltration we are doing at that particular some part of the part wherever the some nerves are there, they will be sensation will be lost. In the field block, whatever the nerves are there, all those nerves at that field will be having blocking of the sensation. Here nerve block we are doing complete that particular nerve wherever it is supplying will be blocked. Okay, that is nerve block. Spinal and epidural anesthesia. See, here the spinal anesthesia we are giving into the spine, and epidural anesthesia over the epidural. We'll discuss detailedly about this. Spinal anesthesia, local anesthetic is injected in the subarachnoid space between the L2 to 3 or L3 to 4, that is below the lower end of the spinal cord. The primary site of action is the nerve roots in the carda equina. It's not spinal cord, it's mainly in the carda equina. So lower abdomen and the hind limbs are anesthetized and paralyzed. Normally, we will do addition of the adrenaline so that the local anesthetic action, the effect will be increased. For even to the surface anesthesia and infiltration anesthesias also we will use this adrenaline. Here although for the spinal anesthesia also we are using adrenaline to increase or prolong the action. Here we are increasing 1/3 of the action will be increased. Uses of the spinal anesthesia, because it is lower abdomen, prostatectomy, so we can use the surgeries like lower limbs, pelvis, lower abdomen. Example, prostatectomy, fracture setting, obstructive procedures, and even cesareans. So all these are all not the minor surgeries. Normally you might have thinking minor surgeries means up to the thought you will come, the minor surgeries, the wherever we are using the up to infiltration anesthesia or maximum nerve blocks. But these are also cesarean section, all the lower abdominal and the limbs, lower limbs, fracture reduction, all these are also prostatectomy. Everything also minor surgeries only. Wherever whatever we are using for the local anesthetics are minor surgeries. In during the pregnancy, actually we can, there is a less requirement of the drug for the spinal anesthesia due to the inferior vena cava will be, which will be compressed by the enlarged uterus, which leads to the engorgement of the vertebral system. That's why there is a decreasing in the capacity of subarachnoid space. The subarachnoid space is decreased so that the amount which has to be diffused at that place will be decreased. That's why the dose or the requirement of the drug will be lessened in the pregnant women in the later stages. Let's come to the epidural anesthesia. Here, the local anesthesia will be injected in this space, in the epidural space. Primarily acts in the nerve roots in the epidural as well as subarachnoid spaces, to which it diffuses, and small amount permeates through even through the intervertebral foramina to produce multiple paravertebral blocks too. Here it is diffusing, almost all kinds of this particular drug is diffusing, even different routes, infusion also it is diffusing, nerve block, conduction blocks. Here also the drug is diffusing in that particular places wherever it can diffuse. It diffusing in the epidural space or subarachnoid space and through the intervertebral foramen also. It decreasing the blocking the paravertebral areas block. Epidural anesthesia basing on the injection site and the areas where we are giving, getting the response, they are divided into three types: thoracic, lumbar, and caudal. Thoracic is injected in the mid-thoracic region. The epidural space in this region is relatively narrow, therefore smaller volume of the drug is needed. Where we can use these drugs are for pain relief following thoracic upper abdominal surgeries. Here actually in this thoracic and upper abdominal surgeries, we did that, those surgeries by using the general anesthesia. Post surgical pain maintenance, we are using these particular epidural anesthesia, thoracic epidural anesthesia. When it comes to the lumbar, the large volume of the drug is needed because of the epidural